On June 21, 2009, Nepha Freeman and I, Devin Walker, traveled to the Bolivarian Republic of Venezuela on behalf of the People Before Profit Community Healthcare Project. The trip was coordinated through the Venezuelan Embassy in Washington, D.C. We requested this trip because our project is modeled after and inspired by the excellent Cuban healthcare system. We are also encouraged by the great achievements of the Venezuelan healthcare system since the democratically elected Hugo Chavez became president in 1999. Beginning in June 2003, through a trade pact with Cuba, Venezuela began to bring Cuban doctors, medical technology, and medications into rural and urban communities free of charge in exchange for low-cost oil. Given that Venezuela is in the process of transforming its economy from a profit-oriented society to a people-oriented society, we wanted to go and see firsthand how they were doing in this transition. The People Before Profit Community Healthcare Project was started in 2004 by the former Pan-African Liberation Organization and two organizations within the Howard University School of Medicine, the American Medical Student Association and the Physicians for Human Rights. Like the Cuban and Venezuelan healthcare programs, our pilot project is an alternative healthcare model predicated on people, not profit, to effectively address the healthcare concerns of residents within a 9-block radius of Northeast Washington, D.C. We created the Community Health Education Workers, also known as the CHE workers, made up of members of the community, medical students, and other volunteers who believe in community medicine whereby doctors live in and are part of the communities they serve. It is our goal to provide health education literature and assist residents with navigating through the difficult and inefficient healthcare system in both the District of Columbia and the United States. After arriving at the Simón Bolívar International Airport, we were greeted by the president of the Union of Federation Workers, Octavio Solozano, and one of our two interpreters, Yasser Ledesma. We traveled about 30 minutes to the capital city of Caracas and checked into the Abba Hotel, which was formerly the Hilton Hotel. After resting from our trip, we started the next day with a visit to the Ministry of Health in downtown Caracas. There, we were greeted by the Ministry of Health, Oscar Garcia, and several representatives of the Venezuelan labor movement representing health employees. Here, we were given an excellent history of the Venezuelan healthcare system and the movement for socialized medicine in Venezuela. With the election of President Chavez in 1999, the people of Venezuela sanctioned the Constitution of the Bolivarian Republic of Venezuela, which establishes that the republic is a democratic and social state of law and justice. The institutional changes undertaken in this new constitution proposed a profound revision in the way in which social policies are designed and implemented. One such policy is established in Article 83 of their constitution, which is the right to health care. As stated in their constitution, the health care is a fundamental social right the state is obliged to guarantee as part of the right to life. This justifies the political decision for the opening of the Venezuelan Social Security Institute to provide health care to the entire population, regardless of the size of the contribution each individual is capable of making to the system. Prior to 1936, Venezuela had no social institutions for health, and there were only about 5 or 6 hospitals in the whole country. In that year, following the death of military ruler and U.S.-supported Juan Vicente Gomez, a Ministry of Health was created. Under the Ministry of Health, Venezuela's main focus was on prevention and the promotion of good health practices. This ultimately led to the passing of Venezuela's first income tax and Social Security laws in the 1940s. By the late 1970s, Venezuela saw the rise of neoliberalism, which is a political term to describe new ways of transferring a country's national economy from the public sector to the private sector. For the next 2 decades, healthcare in Venezuela became privately owned and controlled. This process was supported and led by the United States and the International Monetary Fund. Only 50 new public health facilities were established during these 2 decades versus some 400 private clinics. The World Health Organization pointed out that between 1990 and 1998, Venezuela's impoverished population had reduced access to medicines because of cost recovery policies. By 1999, Venezuela's poverty rate had reached 50% as a result of neoliberalism. Since the election of President Hugo Chavez in 1999, Venezuela has begun to reverse the backward policies of the IMF by developing a society based upon the redistribution of wealth and the principles of solidarity. They're doing this through the enactment of the Social Economy Act in the 1999 Constitution. Through this process, there has been an increase in social spending from 9.5% of their gross domestic product in 1998 to 17.5% in 2008. Venezuela has reduced their public debt from what was 30.6% in 1998 to what is now 13.5%. They've also seen a drastic decrease in extreme poverty from 20.2% in 1999 to 9.5% in 2007, and household poverty dropping from 42% in 1999 to 28.3% in 2007. But we were here to see about the achievements in health. How have they done in this area? An important aspect of their healthcare system is Mission Barrio Adentro, started in 2003, which means Up and About the Ghetto Mission. It was conceived with the general objective of ensuring access to healthcare services to excluded sectors of the population. This is done through an integral health management model oriented towards the accomplishment of better quality of life via the creation of people's clinics and centers of integral diagnostic centers. Doctors are appointed to each one of these areas, whose mission is to visit people's homes, thus making healthcare even more accessible to Venezuelans. We visited the Integral Diagnostic Center in El Ingenio, located in the state of Miranda. It is located about 23 miles east of Caracas. Here we met community leaders, medical personnel, students, and school officials. We also met Cuban doctors who live and work in this community. Barrio Adentro has invited Cuban doctors to treat, train, and live with working-class Venezuelans in communities across the country. An estimated 20,000 Cuban doctors have been sent to Venezuela to serve in poor communities and have held millions of educational programs focused on preventing high-risk behaviors and improving nutrition. Also, neighborhoods organize themselves into local health committees to oversee the operations of clinics. Barrio Adentro enlists the patient as a partner in the care of his or her health. At the Integral Diagnostic Center in El Ingenio, we were given a tour of their facilities, which also have the capacity to treat trauma victims. In collaboration with Cuba, Venezuela is able to provide free health care to all of its citizens. But more importantly, they also provide free services to other countries around the world. The question is, how do they pay for this? Venezuela's economy is highly dependent upon oil revenues, which account for more than half of all the government revenues. Venezuela is the fifth largest oil producer in the world and is the largest in the Western Hemisphere, known as Petróleos de Venezuela, or PDVSA. Citgo Petroleum is 100% owned by PDVSA. Under the Bolivarian Revolution, the profits gained through oil are used to finance their free healthcare system and other social programs throughout the country. Another great achievement of the Venezuelan healthcare system is the pediatric hospital in Caracas called the Dr. Gilbert Rodriguez Ochoa Hospital Cardiológico Infantil Latinoamericano, named after the former Minister of Health who was killed in an automobile accident in 2002. This hospital opened on August 20th, 2006 and treats approximately 3,000 patients from around the world. Yes, free of charge. This hospital is part of a network of 16 hospitals in the country. By far, this was one of the cleanest and well-organized hospitals either one of us have ever seen. It has 142 rooms that sleeps 2 patients to a room, along with 2 sofa beds so that a parent can stay with their child. This was beautiful. The answer to the U.S. healthcare crisis is in Latin America, led by Cuba and Venezuela. The People Before Profit Community Healthcare Project is committed to learning from and working with our family and friends in Latin America to resolve the healthcare crisis in the United States. Help us to get the message out to elected officials and in our communities that the only answer to solve the healthcare problems in the U.S. is to change its priorities from a profit motive society to a people motive society. Similar to the economies of Cuba and Venezuela, the majority of the U.S. budget must be put into social programs, not given to the Pentagon in the form of guns, missiles, and military jets. We need all profits gained from the nationalization of the banks and the auto industry in the U.S. to go directly toward establishing a universal healthcare system. Go to peoplebeforeprofit.org for more information. And remember, our health is not for sale.